So today we will discuss something about the topic CLL, chronic lymphocytic leukemia. So what is CLL? CLL is a monoclonal proliferation of mature B cells defined by an absolute number of malignant cells in the blood. So as you know, the acute lymphocytic leukemia, there is blast cell proliferation, while in CLL there is proliferation of mature B cells, that is B lymphocytes, and there are malignant cells in the blood. Now it is one of the most common leukemia, age group of more than 60 and median age is 70. In the older age group it occurs mainly, and in the male is predominantly in the male, and it is extremely low in the Asian countries. And benzene rubber industry, the workers of that industry are more susceptible to CLL. CLL is one of the most familial associated malignancies. So what are the clinical features? As you can see, lymphadenopathy, it is one of the most common clinical feature. Lymph node enlargement can be generalized or localized, and it may vary greatly in size. The most common affected sites are cervical lymph nodes, supraclavicular and axillary. Now the enlarged nodes are firm, rounded, discrete, non-tender and freely mobile upon palpation. Now another feature is that splenomegaly and hepatomegaly, and there are also anemia, immunohemolytic anemia, thrombocytopenia, leukemia cutis, membranoproliferative glomerulonephritis, Richter's transformation, there is aggressive lymphoma. Now the investigations. As you can see here, there is anemia, neutropenia and thrombocytopenia, that is pancytopenia, but still the lymphocyte count is high. The absolute lymphocyte count is more than 5000, and you will see smudge cells, basket cells, immune thrombocytopenia, cum test DAG positive, CD15 marker 19, 20 and 23 positive, kappa and lambda immunoglobulin light chain positive. Now this is the another smear, peripheral blood smear. You can see the two big cells, the one indicated by the red arrow, it's actually a basket cell or smudge cell, and other rounded cells you can appreciate there are five or four, there are five, actually five, there are 5 CLL cells, mature B lymphocytes. Now this is a peripheral blood smear picture, and another one is bone marrow aspiration picture. Now what is the prognosis? So binary staging system for CLL. The stage A, 2 or less lymphoid bearing areas enlarged. Stage B, 3 or more lymphoid bearing areas are enlarged. Stage C, presence of anemia or thrombocytopenia. Now 5 lymphoid bearing areas are possible. There is cervical, axillary, inguinofemoral, spleen and liver. So in the stage A, among the 5 lymphoid bearing areas, 2 or less, like spleen and liver. If there is splenomegaly and hepatomegaly, or only splenomegaly or only hepatomegaly, then the prognosis is stage A. Now if there are 3 or more lymphoid bearing areas, for example say splenomegaly, hepatomegaly and cervical lymphadenopathy, now staging is, what is the stage? Yeah, it's stage B. And if there is anemia or thrombocytopenia, then it's stage C. Now there is another classification, staging system, modified dry clinical staging system for CLL. Now if there is lymphocytosis in blood or bone marrow, the risk is low and the stage is 0. Now if lymphocytosis is associated with enlarged lymph nodes, that is lymphadenopathy, Then it is stage 1 with intermediate risk, and if there is lymphocytosis with enlarged spleen or liver, with or without lymphadenopathy, then it is stage 2, intermediate risk. But if there is lymphocytosis and anemia with or without enlarged liver, spleen or lymph nodes, then the risk is high and it is considered as stage 3. And if lymphocytosis is associated with thrombocytopenia with or without anemia or enlarged liver, spleen or lymph nodes, then it is stage 4, again high risk. Now what is the treatment? As you can see, there are 4 groups: chemoimmunotherapy and monoclonal antibody therapy. So the drugs are fludarabine plus cyclophosphamide and anti-CD20 monoclonal antibody rituximab. And there is another group called B cell receptor signal inhibitors, idelalisib and ibrutinib. And then there are anti-apoptotic therapies like venetoclax and immune therapies like chimeric antigen receptor T cell therapy. So this is the end of the slide. Thank you.